Well, good afternoon, everybody. Welcome to the Health and Human Services Subcommittee on Budget and Taxation. We're meeting today for the purpose of budget hearings, for agency overviews and analysis. Members are going to be coming in and out, but I know it's a Friday afternoon, so we just wanted to make sure that we were keeping everything running on time. Just in case people were wondering about the order, we're going to go Department of Aging, then we're going to go Health Professional Boards and Commissions, and then the Office of Healthcare Quality. The way it's going to roll is we're going to have Department of Legislative Services offer the analysis, and then we'll have the agency response. So with that, we'll start with the Department of Aging. Naomi Camaro. Thank you.
Thank you, Mr. Chair. My name is Naomi Camaro. I'm a budget analyst with the Department of Legislative Services, and I'll be presenting the budget for the Department of Aging. The fiscal 25 allowance includes $90.4 million in the Department of Aging. As you can see from the chart on page 1, this is a slight decrease from the fiscal 24 working appropriation of $3.8 million, mostly due to the expiration of federal stimulus dollars. On the next page, I wanted to point out a couple of points related to the fiscal 24 budget. The fiscal 24 appropriation includes $1.15 million for grants to the organizations listed at the bottom of this page. As of this writing, the Department of Aging has issued the first quarter of payments and is processing requests for the second quarter of payments. The fiscal 24 budget bill also included $8.5 million to address waitlists in the senior care program, which is administered by all 19 of the local AAAs. This program provides financial assistance and other supportive services to allow older adults to age in place in Maryland. And I'll be discussing that in a bit more detail further on. The Department of Legislative Services has asked the Department of Aging to discuss efforts working with grantees to make sure that they're able to access and receive distributions of the grant funding before the end of fiscal 24. I'm going to move on to page 4. This pie chart, Exhibit 1, shows a breakout of the spending in the fiscal 25 allowance. The greatest portion of funding is going towards state programs, which include senior care. There's also $25.2 million in the budget allocated to programs required by the Older Americans Act, which include meal delivery and in-home services. On pages 5 and 6, Exhibit 2 breaks out the major changes between the fiscal 24 working appropriation and the fiscal 25 allowance. Again, the total budget decreases by $3.8 million. Much of that change is driven by the expiration of Coronavirus Response and Relief Supplemental Appropriation and American Rescue Plan Act funding. There's a decrease of $8.2 million in the allowance for this. And this is offset slightly by increases in federal funding to support Older American Act programs, as well as an additional $2.4 million in the budget, which was mandated by legislation in 2023, establishing the long-term care and dementia care navigation programs. This program requires the Department of Aging to establish long-term care and dementia care navigation programs in the local area agencies on aging where they don't already exist, and then strengthen those that do exist, as well as collect and analyze data related to those efforts. On pages 7 and 8, we've listed out the community service grant programs that the Department of Aging offers. I won't go through all of them, but you'll notice there is a slight decrease between the fiscal 24 appropriation and the fiscal 25 allowance. Again, that's mostly due to the expiration of federal stimulus dollars. On page 9, we talk briefly about personnel. So in fiscal 25, the Department of Aging is adding 9 new positions. 7 of those are contractual conversions. And then there's 7 vacant positions as of January 1st of this year. 2 of those have been vacant for more than 1 year. We've asked the Department of Aging to comment on efforts to fill long-term vacancies. And we've also asked them to comment on the function of the new positions that were added. Okay, on page 10 starts a discussion of the senior care program and wait lists. As I mentioned earlier, senior care is offered by all of the local area agencies on aging, and it's one of the state programs with the largest budget in the Department of Aging. In fiscal '24, $8.5 million was added to the appropriation to address wait lists, which have been very high in recent years. On page 11, there's an exhibit that shows the change in waitlist and participation size in each of the local jurisdictions between fiscal '22 and fiscal '23, over the course of fiscal '23. So the beginning of fiscal '23 to the end. And you can see that in almost every jurisdiction, participation grew pretty significantly. Waitlists also grew modestly in most of the jurisdictions. One thing I'll note on senior care is that when people are enrolled, they're often participating in the program for a long time. And so while many of the local AAAs have been able to expand their programs, they were a bit hesitant to spend the full allocation of the $8.5 million enhancement without the guarantee of it being included in the fiscal '25 allowance. So there is a planned reversion of $4.5 million included in the budget, and then fiscal '25, the program is level funded at $13.9 million. On page 12, Exhibit 5 breaks out this funding, so you can see that there's an increase of about $1.5 million between fiscal '22 and '23, and then in fiscal '24 and '25, the program is funded at $13.9 million. Given the changing amounts of money that this program has been funded with in recent years, DLS is recommending adopting committee narrative requesting an update from the Department of Aging on senior care participation and costs, including the adequacy of current funding. The next issue begins on page 13, and it's related to federal stimulus funding. As I mentioned earlier, there is a decrease in the budget this year due mainly to the expiration of federal stimulus dollars. On page 14, Exhibit 6 shows the amounts expended and unexpended, both from the Coronavirus Response and Relief Supplemental Appropriations, which I'll call CRSA from now on, and then the American Rescue Plan Act funding. The CRSA funding expired September 30th of 2023, and nearly all of the local AAAs expended 100% of this appropriation. The ARPA funding expires September 30th of 2024. And this data is as of August 30th. On page 15, Exhibit 7 shows the spending by jurisdiction of CRSA funds. So again, nearly all local AAAs expended 100% of this appropriation. Prince George's County had the most amount of money that was unexpended, about $84,000, which they attributed to difficulties with staffing. On the next page, Exhibit 8 is a very similar graph, but is instead showing the American Rescue Plan Act funding, which again expires September 30th of this year. Again, this data is as of August of 2023. We're expecting an update from the Department of Aging March 1st on the local AAA spending of the ARPA funds. Okay, on page 17, there's a discussion of two new programs that the Department of Aging has been tasked with overseeing. The first is the Long-Term Care and Dementia Care Navigation Program, which I've already mentioned. There's a mandated $2.4 million in the budget annually beginning fiscal '25. We have asked the department to comment on the status of implementing this program. The second was established by executive order earlier this year on January 3rd, which is the Longevity Ready Maryland Initiative. And this is a multi-sectoral 10-year plan to address the various needs of older adults in Maryland. As of January 2024, the department reports pretty significant investments in data capacity for this effort. And there's an interim report due July 2025. DLS is recommending adopting committee narrative, requesting an update sooner than that, just to get a sense of what progress has been made on this effort. So that wraps up my analysis. I'll just close with DLS's recommendations, which were to adopt two pieces of committee narrative, the first on the adequacy of senior care funding, and then the second providing an update on the Longevity Ready Maryland Initiative.
Thank you very much. Thank you very much, Ms. Kamara, for that really great analysis. Are there any questions? Okay, Madam Secretary, come on up. Welcome.
Thank you. And I also have my team
Yeah,
that
please
I'm
bring.
going to ask to please come up as well.
Please begin whenever you're ready.
All right. I'm Carmel Roque. I'm the Maryland Secretary of Aging, and I want to thank the chair for helping continue with this committee on time, so we appreciate that. I also want to thank our analyst, Naomi Komoro, for her tireless efforts to work preparing our DLS analysts for today, and also the entire subcommittee. Thank you very much. I have with me today Deputy Secretary Jennifer Crawley, CFO Michael Zumber, Chief of Staff Pam, and Eloise Main, who oversees our grants administration function in the department. I also want to acknowledge and thank the presence today of the area agencies on aging, and I have some directors behind me if they would like to stand and just be acknowledged. The 19 area agencies on aging are the provider network for Maryland, and although they are not employees of the Department of Aging, they are our partners in the delivery of care at the local level. When I testified regarding the Maryland Department on Aging budget a year ago, I shared the values and aspirations of Maryland Department on Aging. And one of the things that I spoke about was the desire to center the well-being of older people, their families, and their care providers across state government, and also to ensure that all older Marylanders have the desired outcome of living lives that are healthy, financially secure, socially connected, and purposeful. And we are talking about 16% of the population in Maryland right now, and that population is growing steadily. The fiscal year 2024 MDO budget reflects and supports these values and aspirations. It also reflects the goal of being fiscally responsible while prioritizing the essential investments that support fulfilling our mission. MDOA has taken an all-of-government approach to meeting the responsibilities of the department by very intentionally and strategically partnering with other state agencies, and by refocusing funds to support areas of greatest impact and adjusting funding to make programs more sustainable. We understand that there are both personal and social implications of living longer lives, this phenomenon that we call longevity. For each of us, there is the biological reality of a lifespan that now includes decades of life past 60. And we know that it will be a very short time when we can expect 100 years to be the normal life expectancy and lifespan. And we know in our society there is a demographic reality in which the population under 18 is declining while the population over 60 is growing. And this creates its own unique challenges and opportunities. The overarching framework for all of MDOA's work is to plan and prepare for Maryland so that we can be ready, we can be longevity ready. We want a Maryland that is able to successfully address the challenges and the opportunities of a longer-lived society so that all of us can thrive and grow and no one is left behind. MDOA is the state-designated unit on aging tasked with receiving federal and state funds and distributing them to our 19 area agencies on aging. And we also monitor and report on the use of these funds to ensure that they are being effectively and efficiently used for their intended purpose and, importantly, their intended impact. MDOA is also required to plan and advocate for older Marylanders and make recommendations to the governor, to develop policy and legislation that promotes the well-being of older people. In order to fulfill these requirements, the MDOA budget reflects rebuilding the agency to be a 21st century state agency by analyzing the needs of the department and building capacity by filling vacant positions, redefining positions, and identifying the need for additional positions. and by building the organizational framework and capacity very, very significantly for planning, policy, legislative, and advocacy work, which in prior years we were not able to engage in a robust fashion. We're also working on redesigning the Maryland Department on Aging state-funded pre-Medicaid long-term care services and supports program, and we are doing this in collaboration with the Department of Health through a technical assistance grant from Advancing States. I am urging that we continue to support and understand the importance of the multi-sector plan for aging. So we have discussed this in many venues over the last year and a half, and it resulted in an executive order being established, which basically asserts that the Maryland Department on Aging will, in fact, plan for longer lives in Maryland, for a longevity-ready Maryland, and that we will do that in a way that provides strategic, intentional, and focused resources toward improving the lives of older people, their families, and caregivers. We will be required to make an actual plan and have a final report due in January of 2026. But in the interim, much of the work of the department, and you will see this in some of the positions that we required for our budget in this upcoming fiscal year, much of the work of the department will be centered around identifying priorities and beginning the work of moving toward implementing real-life changes for the people of Maryland. So on that note, I think I have completed my testimony, and I am very open for any questions.
Thank you very much, Madam Secretary. And we have your written responses to DLS recommendations, and it sounds like you concur with the with getting in the reports. Are there any questions for the Secretary? The only question that I had was on the Prince George's County spending. Is that the unexpended money? Is that being resolved?
I will say it's being addressed. I can't say it's actually resolved, and it really does have to do with the fact that that department has not been able to successfully recruit and hire staff to actually be able to move funding through the agency and out into community providers. And I visited with them not very long ago, and this is something that they are working on diligently, but it has destabilized the operation of that department. And I know they have some very aggressive recruitment efforts underway. And as the state agency, we offer the support that we can, but we can't fill those staffing gaps.
All right, any other questions? Okay, well, thank you very much, Madam Secretary, to you and your team. If you can, have a great weekend.
Thank you.
Thank you.
We do have some public testimony. We'll start with Ann Seacott. Ann's here, perfect. So, Ms. Seacott, as soon as you get settled, you can start whenever you wish.
Thank you.
Yeah, and I should have said this from the start. So for public testimony, we're going to stay consistent with full committee, so 2 minutes. Go ahead.
No problem. Hopefully not that long. I'm Ann Seacott. Good afternoon. Afternoon, everyone. On behalf of the Maryland Association of the Area Agencies on Aging, those are, as you well know, the agencies at the local level that provide essential services to your constituents. We are here to express our full support for the proposed budget. We want to just highlight a couple of things. You've heard about the senior care program. First of all, we thank you for what you did last year with the $8 million. We are thrilled that $4 million of it is now worked into the baseline. It was certainly a very big concern of the AAAs to get people off a waiting list, start them on services when they weren't sure how much, if any, of that money would continue. And now I think they're going to be able to really speed up a lot of that. They are interested in some flexibility. They'll work with the secretary, who's been great to work with, and her staff to make sure that it's being used as effectively as possible. We are very pleased with the $2.4 million being funded in the budget for the long-term care and dementia navigation. And we are also very thrilled about the Longevity Ready Maryland plan. It's been a long time in coming that we have this multi-sector plan to really figure out what we're going to be doing as the years go on. So with all of that, we are very thankful for what's in the budget and ask for your support.
Thank you very much. Is there any questions for Ms. Seacott? Okay, thank you
Thank you.
very much. Megan Peters, come on up. Begin whenever you're ready.
Thank you. Good afternoon, members of the Budget Subcommittee. My name is Megan Peters, and I am here today on behalf of the Alzheimer's Association. The association is dedicated to leading the fight to end Alzheimer's, and Maryland has made strides in recent years advancing efforts to support our more than 110,000 Marylanders living with Alzheimer's and the nearly 250,000 caregivers. I thank this committee for your support in recent years to fund key budget initiatives, including funding the state plan, as well as funding to address the senior care program. We are pleased the governor included the $2.4 million in the fiscal year 25 budget for the long-term care and dementia navigation programs, as mandated from legislation last year. This funding is important now more than ever, not only because of our growing senior population, but as well as a recent study released this past summer showed that Maryland has the highest estimated prevalence of Alzheimer's in the nation among individuals aged 65 and older. We're excited to see the department's commitment to this program already, including hiring a staff member to oversee this initiative, and respectfully request your support for this budget. Thank you.
Thank you very much. Are there any questions? Okay, thank you very much. Have a good weekend. We'll now call up Carol Linhart.
Sorry.
Is Linhart here? Great. Good to see you.
Well, good afternoon to all of you. My name is Carol Linhart, and I am the retired director of the Harford County Office on Aging, past president of the Maryland Association of Area Agencies on Aging, and I currently serve as the co-chair for MSCAN, which is the Maryland Senior Citizens Action Network. You have my written testimony, so I'd just like to make a few highlights for you. First, as always, MSCAN commends the Department of Aging as well as all of the local area agencies on aging who are literally on the front lines of providing services to Maryland's now more than 1.4 million senior citizens. Now, as legislators, I know that you hear complaints from citizens about how much it costs to provide government services. But I'd like to sort of call your attention to the fact that the MDOA programs are actually designed to save money by keeping seniors healthy and out of expensive nursing homes, which today cost a shocking $120,000 a year, $10,000 a month. And I know that I have encountered many middle-class folks who have saved $100,000 for retirement, and they think that they're in really good shape. But if you can look at $120,000 a year for nursing home placement, they're wiped out in a single year. So it's really important to have programs like these. And I would like to just say, how do these programs save money? If you look at the Congregate Housing Services Program, for example, it's a program that provides a sort of set package of services that are offered to seniors who live in senior housing buildings. And that package of services costs about $3,000 a year. So in dollars and cents, we're talking about a big bang for the buck because we can serve 3 seniors in congregate housing for the cost of 1 month in a nursing home. Now, we've talked a bit about the senior care program today, and senior care has historically, as long as I've been involved with this, had a waiting list of about 2,100 people.
Ms. Leinhardt, if you want to, we want to finish, I want you to finish the thought, but you want to wrap up soon, that'd be great. Yeah, thank you.
Like this,
Yeah.
okay. Well, senior care costs about $7,000 a year for a package of services, and we could serve the entire senior care waiting list for $15,000 versus institutionalizing 150 seniors who couldn't get services. So these programs actually save a lot of money, and we're delighted to support the Department of Aging's budget, and we thank you so much for your support.
Thank you, and thank you for your time. Is there any questions? Great. Well, thank you very much, Ms. Leinhardt. Patrick O'Malley? Come on in. Welcome.
Good afternoon, everyone. My name is Patrick O'Malley, and I'm here in support of the Durable Medical Equipment Reuse Program. This past September, I was injured by a wave in Ocean City that had me break my neck and have a spinal cord injury. I was flown to shock trauma and was later treated at the University of Maryland Rehabilitation Center, all in all for about 13 weeks. I had inadequate health insurance, so now I have significant medical bills, but needed expensive equipment due to the nature of my injury. The reuse program supplied me with this wheelchair, a hospital bed, and an electric lift so I could get from bed to chair. Without the equipment, I would have not been released from the rehabilitation center. I'm not sure what would have happened, to be honest with you. Having this equipment, just a godsend. Ian and his team do great work for the Durable Medical Equipment Reuse Program and are doing just wonderful work that I benefited from. Please continue to support this program so others like me can benefit from it. Thank you very much.
Thank you, and we love the program. As a matter of fact, colleagues, when I was first in the Senate, I put in the chair of the Capital Budget Subcommittee at the time was questioning why I was putting in a $7,000, which at that time was not a lot, a $7,000 legislative bond initiative to create a durable medical shed for medical equipment in Laytonsville for the Lions Club. So there's one out in Laytonsville, but it's a great program, and this committee has been very supportive of it, and especially with the leadership of Chair McCray. So thank you for coming in and testifying, all of you.
Appreciate it. Thank you very much.
Great. So colleagues, will now, that's the conclusion of the public testimony. So we'll now turn our attention to the Maryland Department of Health, Health Professional Boards and Commissions. And we'll start with Victoria Martinez, who's going to provide the analysis from the Department of Legislative Services. You can begin whenever you're ready.
Thank you, Mr. Chair and members of the committee. My name is Victoria Martinez, and I'm with the Department of Legislative Services. Today I'll be presenting on the Health Professional Boards and Commissions analysis. The Health Professional Boards and Commissions include 20 boards and 1 commission who work to certify, license, resolve consumer complaints, and establish parameters for various providers. As you can see on the first page of the analysis, the fiscal 2025 allowance increases by $5.5 million or 13.4% for a total of $46.7 million. The majority of their budget is funded through special funds generated through licensing fees, and most of the funding in the budget, over 66%, supports regular personnel. Exhibit 2 on page 4 shows the breakdown of the $5.5 million increase. The largest change is $2 million to support personnel expenditures, and the second largest change is $3.6 million within the Board of Nursing for infrastructure operating cost. Page 6 summarizes the changes in the proposed Budget Reconciliation and Financing Act with 3 board fund balance transfers to replace general fund spending under the Behavioral Health Administration. Exhibit 3 on the next page shows the closing fund balance for fiscal 2023 for each of the boards. As you can see, the proposed fund balance transfers include $1.6 million from the Board of Professional Counselors and Therapists, $776,000 from the Board of Occupational Therapy Practice, and $588,000 from the Board of Examiners for Psychologists. Continuing with the personnel section, the fiscal 2025 allowance includes 13 new personnel. Exhibit 4 on page 9 shows the number of vacant positions within each board as of December 31st, 2023. The exhibit shows a total of 32 vacant positions with a vacancy rate of 12.43%, and DLS asks that the boards comment on steps they are taking to reduce vacancies, the impact of the vacancies, and how the savings from vacant positions will be spent. The first key observation on page 10 discusses the board's status in meeting their Managing for Results investigation goals. The boards are required to meet certain goals relating to issuing new and renewal licenses and completing complaint investigations. As you can see in Exhibit 5 on page 11, the boards changed their complaint investigation goal with the time frame for completing complaint investigations by the Board of Nursing, changing from 90% within 270 days to within 540 days, and for all other boards from 100% within 180 days to 90% within 270 days. Exhibit 6 on page 12 shows the number of boards that have missed each of these MFR goals, including those that have missed the complaint goal under the new and the old and the new version of this goal. Although the adjusted goal generally reduced the number of boards that missed this goal, 8 boards still missed this goal in fiscal 2023 under this new goal. This is concerning as the board should be investigating practitioners with whom consumers have filed complaints in a timely manner. And DLS asks that the boards discuss the anticipated impact of the new performance goal. Overall, 3 boards missed all 3 performance measures in fiscal 2023, and DLS asks that these 3 boards, the Board of Audiologists, the Board of Pharmacy, and the Board of Professional Counselors and Therapists, comment on efforts being made to meet all 3 of their MFR goals. In addition, 3 boards missed the complaint investigation goal for the last 5 fiscal years. Language in the fiscal 2024 budget bill restricted $25,000 from various boards pending the submission of 2 joint reports detailing efforts to improve their timeliness of investigations, and as of January 31st, 2024, neither of these reports had been submitted. DLS asked that the Board of Dental Examiners, the Board of Pharmacy, and the Board of Professional Counselors and Therapists discuss reasons for missing the complaint investigation goal for the last 5 fiscal years and efforts to ensure timely investigations. Considering that none of the required reports were submitted and that various boards continue to miss their MFR goals, DLS recommends adding language restricting $100,000 from each of the boards that have missed the complaint measure for the last 5 fiscal years until a report is submitted detailing plans to remedy the low completion rate. The second key observation on page 18 discusses the transfer of the Board of Nursing Infrastructure Operations to the Maryland Department of Health, Office of the Secretary, per chapters 222 and 223. The Board of Nursing is responsible for regulating the nursing industry through issuing initial and renewal licenses that individuals need to enter the workforce. The boards have experienced various challenges such as staffing shortages and budgetary constraints that has led to a significant backlog of nurse applications and high case processing times as shown in Exhibit 8 on page 16. An independent evaluation of the board's infrastructure and operations highlighted key inefficiencies, including personnel, process, and technology-related deficiencies, and developed an action plan for implementing its recommendations. DLS asked that MDH comment on the details of this plan and timeline to implement the action plan developed. In addition, to implement the legislation, the fiscal 2024 budget included $8 million in general funds for the Office of the Secretary, though there is a proposed deficiency reducing this amount to $5.3 million. Fiscal 2025 provides $4.3 million in general funds for the Office of the Secretary for this purpose and reimbursable funds in the Board of Nursing. Considering that the infrastructure operations are being performed by the Office of the Secretary in accordance with the legislation, it is unclear why the Board of Nursing's fiscal 2025 allowance includes reimbursable funds, especially since the fiscal 2024 working appropriation does not. To align the accounting of infrastructure operations with the fiscal 2024 working appropriation, DLS recommends striking the fiscal 2025 language that allows the Board of Nursing to receive reimbursement for services provided for the Office of the Secretary. DLS also asked that the Board of Nursing comment on how the infrastructure operations are being conducted, including reasons for receiving reimbursable funds in fiscal 2025 only. Page 20 summarizes the 2 recommendations that I spoke about, including the one I just mentioned about the Board of Nursing's reimbursable funds and the MFR goals. And that concludes my presentation, and I'm happy to take any questions that you all might have.
Well, thank you very much for that thorough analysis. Are there any questions for Ms. Martinez? Okay. Seeing none, we'll call up the boards. Ms. Farrelly, if you want to call up anyone else that wants to come up with you. And please begin whenever you're ready.
Good afternoon, Senator Zucker, members of the subcommittee. My name is Erin McMullen. I'm Chief of Staff at the Maryland Department of Health. I'm joined today by my colleagues, Ms. Kim Link, who is a Senior Advisor to the Secretary on the Health Occupation Boards, as well as Ms. Rhonda Scott, the new Executive Director of the Board of Nursing. I just want to thank Ms. Martinez for her thoughtful analysis of the boards and my opening remarks are really going to be limited to that at the Board of Nursing. There's other members from health occupation boards here, should you have any questions about their written responses. But in Maryland, we do have 20 health occupations boards that license and regulate over 400,000 healthcare professionals. Over half of those are regulated by the Board of Nursing. Except for the Board of Nursing and the Board of Physicians, the Secretary actually has no authority over board staff and operations. That includes policy, licensing, investigation, or disciplinary functions. As I mentioned, the first several prompts of the DLS analysis are directed at the other health occupation boards, so I'm going to skip over those. But I did want to address the last 2 prompts from the analysis. The first one asked the department to comment on its details of its plan and timeline to implement the independent evaluation that was done as part of emergency legislation last year. So since the passage of chapters 222 and 223 of 2023, MDH has been working in really close partnership with the Board of Nursing to improve infrastructure and operations there. While that legislation took effect in April, as part of the bill, we were required to contract with an external evaluator. That final report was submitted to you all in September, and there's a slide deck attached with your materials on where we are in implementing all of those findings. But as Ms. Martinez said, there were 3 real key areas that were called out by the independent evaluators, as well as the DLS team at OPEGA. So those 3 areas relate to personnel, technology, and processes. I'm not going to go through all the written responses, but as it relates to personnel, can't emphasize enough how important it was to get new leadership at the board. Ms. Scott was named as the executive director this fall. She is an incredible nurse leader who's really focused on transforming the culture out at the board. Since April, when the legislation was signed, the board's vacancy rate has fallen from 21% to 14%. On the technology front, one of the first steps that we took was to reconnect the board. You may remember there was a cybersecurity incident in December of 2021. The board had never been reconnected. That was completed in June, and that really was foundational for the additional technology work we're doing with the board. Top of mind is really what we have through the major IT development project to get the board a new licensure system. We've been working closely with the board to get that scoped out and underway. And then as it relates to the processes that were identified by the independent evaluator, a lot of them really have to do with getting the board new infrastructure and new technology. So many of the things they identified will be addressed by the procurement of a new system. The next prompt in recommendation does recommend striking the fiscal 25 budget bill language as it relates to reimbursable funds, and we do respectfully disagree with that recommendation. This was discussed some yesterday in the MDH administration budget, but the fiscal 24 budget did include an additional $8 million in general funds to support the infrastructure and operations at the board, and these are in addition to the special funds the board gets through licensure fees. So per the emergency legislation last year, the department's actually limited in how it can spend that funding. The funds really can only support infrastructure and operations, and there's a definition in the bill that we had to follow. We worked with the Office of the Attorney General, and we're not allowed to fund anything related to licensing, investigation, disciplinary activities. So based on the statute, we anticipated spending $5.3 million in the current fiscal year. So the appropriation shouldn't be characterized as savings. We're really just truing up the governor's proposed allowance to align with actual program expenditures for the board. And then for FY25, the items that were called out, the $4.3 million, that's really to provide additional runway. The emergency legislation was enacted for 2 years, and we're working with the board to increase licensure fees. For the reimbursable fund relationship, this is permissible through the state finance and procurement article. We worked closely with DBM last year to set up this reimbursable fund arrangement. We anticipated at the close of this fiscal year doing a budget amendment to effectuate that. But that concludes our responses. We're happy to take any questions, and if you have questions for the other health occupation boards, they're also here as well.
Well, thank you very much, Ms. McMullen. Always good to see you. Any questions? All right, I don't see any. Thank you very much. All right, we do have public witness up. Is there anyone else from the boards that are going to come up or come on up? Please come on up then. Welcome.
Thank you. Good afternoon. I am Dina Spates-Napata, the Executive Director of the Maryland Board of Pharmacy. Nice to be here to give you some information on how I think we got to this point with our complaint, high number of complaints, and what we plan to do in the future. So I submitted a statement that basically explained a couple of things that led to this situation occurring. One, I think, was COVID and the impact that COVID had in our pharmacies. You probably are well aware of the HHS Test to Treat program, which sent many people into our pharmacies, particularly chain pharmacies, to get COVID tests and also to get treatment. That flooded our pharmacists, and as a result, we did get an increased number of complaints that were due to that specific event. We also had a cyber attack that delayed some of the processing of some of the work that we were doing in the pharmacy as well. And then to top it off, we had some staff transitions that happened in an inconvenient time that I think also were impacted by COVID. So some of the things that we're doing to address these issues, which we've already started doing now, and as a result, we've decreased the complaint cases that were in the that were over 180 days down to 10 cases. So I think we had like 75 to 100 cases that were over that, and we're already down to 10. Some of the things that we did do and that we're going to continue to do is to use subpoenas to obtain information from licensees faster, so that when we need this information, we don't have to continue to wait 6 months, 7 months to get the information. We can just subpoena the information, and legally, that would be legally binding. Another thing is categorizing and assigning cases to staff in a more efficient manner, categorizing cases by the type of case and how long we think those cases will take, and then maybe even specializing and selecting particular staff to process particular cases. We've been doing that, and that has also led to more efficiency. We're also looking at more training for staff in the office, particularly in the first 6 months that they're working with the board, coming in every day, which, is not popular right now. A lot of people don't want to come into the office every day, but we're requiring that for the first 6 months so that the employee can get used to the practices of the board, the practice of their supervisor, and how to work efficiently with our other partner agencies. So we're thinking that, and also the increase in salary potential that MDA has implemented has also helped to get more efficient employees. At this time, we have only 3 staff vacancies. They all occurred in December of 2023. And 2 of those vacancies are posted currently, and we're recruiting at this time. They've already been posted. And 1 we are actually interviewing for next week. So we do a pretty good job of filling our positions. So that's our update.
Good afternoon. I'm Keena Stevenson, Board of Audiologists. I am coming on behalf of my board today to ask for your consideration regarding some missed goals for the past fiscal year. I would like to point out that upon taking this position in November 2023, we were suffering from a severe staff shortage that caused a major backlog in applications and also in complaints. We are currently at a full staff capacity. When I came into office in November 2023, I had 1 staff member. As of the end of this month, I will have 5 staff members. So, that is definitely something that we are very excited about, and thinks that the end result in that would be a much better report for us for next year.
Well, thank you very much. Is there any questions for this panel? Okay, thank you very much. Is there anyone else from the board and the commissions that was going to come up? Just want to make sure I don't miss them. Okay, well, thank you very much. Ms. Elliott, you can start whenever you're ready. Welcome.
Thank you, and good afternoon. Robin Elliott. I'm here today on behalf of the Maryland Occupational Therapy Association and the Licensed Clinical Professional Counselors of Maryland, and have been working on the health board's budget since I started at DLS many years ago in 1999. So I've seen fund balance transfers before and understand them. I do want to highlight that the proposed fund transfers from the Board of Occupational Therapy and the Board of Professional Counselors really want to explore some key questions. First of all, are those fund balances so high because money was set aside for other things, or they haven't filled vacancies? Really want to get into the details and make sure that those fund transfers don't cause unintended consequences. The second thing I'll just mention is that with this incredible period of health professional shortages, to essentially fund the Behavioral Health Administration in part with license fees from the behavioral health professionals who are at the moment extremely stretched to meet the needs of Marylanders, just doesn't feel well for those practitioners. And so we would really like to work with you all as well as the Governor's Budget Office to try to find some other solutions to this. And I will definitely be circling back as we learn more about the fund balances. And I know the place to really talk about this is the BRFA hearing, but just wanted to flag it a little bit early for you all. Thank you.
Great. Well, thank you very much. Any questions? Okay. Well, thank you very much. Have a great weekend. Colleagues, we'll now turn our attention to the Maryland Department of Health, Office of Healthcare Quality. We'll start again with Ms. Martinez for the analysis.
Thank you, Mr. Chair and members of the committee. My name is Victoria Martinez. I'm with the Department of Legislative Services, and I'll also be presenting the analysis for the Office of Healthcare Quality. This office licenses and certifies several types of healthcare programs and facilities for compliance with state and federal health, safety, and quality of care standards. As you can see on the first page of the analysis, the fiscal 2025 allowance increases by $7.4 million, or 23.1%, for a total of $39.6 million. As you can see in Exhibit 1 on page 2, over 83%, or $32.8 million, supports regular personnel. And as you can see in Exhibit 2 on the next page, the largest share of personnel cost is in the long-term care unit, followed by the developmental disabilities unit. Exhibit 3 on page 4 shows a breakdown of the $7.4 million increase. The largest change in the budget is due to a $3.9 million increase in funding in the long-term care program that I will discuss in more detail later in this presentation. The second largest change is due to personnel, with $2.4 million for salary increases due to the fiscal 2024 cost of living adjustment, and $1.6 million associated with 20 new positions. Continuing with the personnel section, Exhibit 4 on page 6 shows that vacancies and the number of filled positions have fluctuated in the past few fiscal years, with a vacancy rate low of 8.3% in May 2023 and a high of 17.2% in January 2023. DLS asked that the Office of Healthcare Quality discuss why the vacancy rate has recently increased and what efforts are being made to fill vacant positions. The first key observation on page 7 discusses the office's mandated survey activities across its monitoring units. There was a ransomware attack that occurred in December 2021 that led surveyors to lose access to the database for managing survey records until regaining access in May 2022. The agency reported that the process of re-entering and verifying data collected during the ransomware attack was completed by March 2023. Exhibit 5 on page 8 shows the office's annual survey rates in the developmental disabilities unit, while Exhibit 6 on the next page shows recent survey activities in the assisted living unit. Both of these exhibits show that the Office of Healthcare Quality has not been meeting their goal of surveying all licensed providers for both of these units annually. And over this 6-year period, neither unit has ever reached its annual survey mandate. Exhibit 7 on page 10 shows the long-term care unit's recent survey activities. The number of surveys grew significantly in fiscal 2021 because the office was required to conduct COVID-19 related focused infection control surveys. The mandate from the Centers for Medicare and Medicaid Services that required these surveys expired as of May 11th, 2023, so these surveys were no longer needed in fiscal 2023. As you can see in Exhibit 8 on page 11, there's been a growth in the number of providers under the agency's oversight, with an increase of 46% from fiscal 2015 to 2023. The increase in providers, in addition to vacant positions within the agency, have contributed to the low survey completion rate. The next key observation, which begins on the next page, discusses the end of mandated staffing support in Chapter 454 of 2018 that provided 10 new positions each year for 5 years to assist the office in meeting these mandated survey goals. Exhibit 9 on page 13 shows the distribution of the 50 total positions across monitoring units, in addition to 20 additional positions in the fiscal 2025 allowance that were not mandated. The long-term care unit received the most positions over this period and also received 13 of the 20 new positions in fiscal 2025. DLS asked that the agency comment on the long-term care unit's ability and plan strategies to fill 13 new positions in fiscal 2025. In addition to receiving these positions, in fiscal 2025, the long-term care unit also receives $3.9 million for subcontractor nurse surveyors to conduct overdue complaint surveys in nursing homes. MDH reported that the subcontractor nurse surveyors will complete pending complaint surveys, while the merit positions will conduct annual surveys. The agency reported that this additional support is needed due to an insufficient number of nurse surveyor positions to complete both state and federal mandates. DLS asked that the Office of Healthcare Quality provide the number of complaint surveys in nursing homes that are overdue and their impact, in addition to the planned use of these funds, including the timeline for awarding a contract and for resolving overdue complaint surveys. Moving on to the discussion of the last key observation, starting on page 14, CMS proposed a rule that would set federal requirements for staffing levels at nursing homes and assisted living facilities that would reduce the risk of unsafe and low-quality care in facilities. Among other changes, the rule would require nursing homes to have a registered nurse on site 24 hours a day, 7 days a week, and would require that certain minutes per resident day of care be provided by registered nurses and nurse aides. A White House statement indicated that the proposed minutes per resident day of care from registered nurses would exceed current staffing standards in nearly all states, as well as in all states for the requirement from nurse aides. DLS asked that the agency provide estimates for the number of providers in Maryland that do not currently meet the minimum staffing levels required in the proposed CMS rule, and any projected operational impact of ensuring provider compliance. Lastly, our recommendation, as stated on page 16, is that we concur with the governor's allowance. That concludes my presentation, and I'm happy to take any questions that you all might have.
Well, thank you very much for that thorough analysis. Any questions from Ms. Martinez? Okay, why don't we have the department come up? Welcome. And you can begin whenever you're ready.
Good afternoon, Chair and members of the subcommittee. I'm Dr. Nilesh Kalyanaraman, the Deputy Secretary of Public Health, and I have Dr. Nay, the Executive Director of the Office of Healthcare Quality, with me as well. I just wanted to give you a little bit of an overview of OHCQ. Currently, they oversee about 21,000 providers across 47 types of healthcare facilities and community-based programs. And really their function is to assess compliance with state licensure and federal certification requirements in healthcare facilities across these wide range of programs. As Ms. Martinez noted, OHCQ has consistently seen year-on-year increase in the volume of providers that they need to oversee. And just in the last year, they saw a 6.7% increase, primarily in residential service agencies, healthcare staff agencies, and sites serving individuals with developmental disabilities. So with that annual growth, OHCQ needs to grow as well to meet that increasing demand. There are a number of highlights that I want to note. OHCQ has implemented some revised licensure processes for healthcare facilities and community-based providers to result in faster processing of licensure applications. They've implemented a new software platform for survey activities across 17 provider types, And they've enhanced the long-term care change of ownership dashboard to include information on the process, required forms, links to resources, and a real-time list of those facilities with a change of ownership. This budget allowance provides essential investments to address healthcare quality and oversight in the state. I'm not going to read through our responses to DLS. I just want to highlight a couple of items that I think are important. One is OHCQ does have the ability and is actively filling vacancies. The 17.2% vacancy rate reflects new positions added in FY24 and merit conversions, and those are actually being filled, and currently our vacancy rate is down to 8.99%. The other item I wanted to highlight is around the number of complaint surveys and what we're doing. Unfortunately, we're not able to share publicly report on pending complaints because this is considered CMS data. But what I can share is that public federal data shows that Maryland is one of 49 states with overdue annual nursing home surveys. We're looking at a two-pronged strategy to be able to decrease the number of overdue complaints and annual surveys. One is increasing the number of OHCQ nurse surveyors to meet the current federal and state nursing home mandates. And the second is time-limited funds so that we can contract for nurse surveyors to clear backlogged pending complaints. With this two-pronged strategy, we estimate that we can clear about 2/3 of the overdue complaints, and over the next year, bring down our overdue annual surveys by 40%. So this will get us a part of the way there, but not the full way there. So with that, I thank you for your time, and we're happy to answer any questions.
Thank you very much, Mr. Deputy Secretary. Dr. Ney, any questions for this panel? Senator Hedelman.
Thank you very much, Mr. Chairman. I have two questions. One goes to the proposed federal rule, and the way
I read your response is that you are undaunted by this, that you feel pretty secure that our current senior living communities and nursing homes meet the requirements, and our state law overlaps sufficiently with federal law so that you're good with it.
Yeah, we're in a very good position from that standpoint.
Okay, just want to be clear on that. The second is, and this is a small issue, but it is an issue to some folks some small businesses in my district. You are required to keep a list of all licensed assisted living communities, and it used to be kept on an Excel spreadsheet so that some of these small businesses could search by zip code. It is now preserved on a Word document in alphabetical order, making it, and it's thousands, right? So it makes it extremely difficult for people who are trying to help families find an appropriate assisted living community, a licensed assisted living community for their loved ones, to search by location, to search, for a particular neighborhood that might be near to the family member. It seems like a very small thing, but it's taking an enormous amount of their time and energy to do it. And so if you could somehow figure it out so that it could be searchable by zip code and or go back to the Excel spreadsheet where they can do what they need, that would be much appreciated.
I'm going to turn it over to Dr. Ney, Senator Hedelman.
Yes, it may seem like a small issue, but there are many calls to our office. This is simply due to the transition to the new software. So we're closing it out of one system, putting it in the new one. We have it already queued up, have already run it. So starting March 1st, you'll have a licensee directory in Excel with some additional columns too. So you can search by city, zip code, by your jurisdiction. It has the number of licensed beds, and it will have whether there's a special care unit for Alzheimer's residents to help facilitate not just people looking for assisted livings, but the industry and lots of other people who want that data. So that and several other Excel spreadsheets are going live March 1st. So that's be resolved.
That is wonderful news. Thank you so much.
Great. Any other questions? No, it's great to end on that positive note. Well, thank you, everybody. That concludes today's budget hearings. Committee, just a reminder, we'll be meeting again on Monday at 1. With that, we are adjourned. Have a good weekend.